Joining us now to talk more about children and vaccines is Dr. Ellen Abraham, a pediatrician with Northwestern Medicine. Thank you for joining us.
Thank you for having me.
Let's clear up first that the vaccines, if they do get approved, is it only just Pfizer?
So at this point, there is also evidence that the Moderna vaccine is showing promise in children age 6 to 11 as well.
Okay, so that will probably be down the road, but first it would be Pfizer. Tell us a little bit about what you're telling some of your clients in anticipation when this comes.
So at this point, what I have been advising parents is to look out for the FDA approval, and as soon as it is approved, I strongly recommend getting the vaccine. COVID-19 has created this pandemic. We know that it is a serious illness for adults as well as children, and we want to protect our children as well as our adults. And there's been significant response in adults in terms of decreasing serious infection with getting the vaccine. And for children as well, we are now seeing evidence that children are also mounting a robust antibody response with the vaccine, which means that in children as well, it can reduce that risk of serious infection.
Talk a little bit about the Delta variant and how it really is affecting these little kids, and all the more reason I would suspect to really consider a vaccination.
100%. With children back in school, we have several mechanisms in place to prevent COVID spread, like indoor masking, hand washing, using hand sanitizers, encouraging teachers and staff to be vaccinated or at least be regularly tested. But despite all that, there is increasing numbers of COVID-19 illness among children, especially with the Delta variant, because we know it is highly transmissible. And so despite all our efforts, there absolutely is a spread of COVID-19 still.
You're going to have pushback on two levels, I would suspect. Number one, kids don't like shots. And number two, there are plenty of parents who are very suspect about a vaccination. What do you do, number one, about kids not liking shots?
I will say there has been significant education for children of all ages in terms of COVID-19, and you will be surprised at how educated our children are about the dangers of COVID-19. And in fact, I find sometimes that my pediatric patients are more ready to get the vaccine than even their parents are sometimes. And the children know that when they get sick, they cannot be in school. They have to miss school. It's created significant issues for them in terms of their education and after school activities and other social events that they have to. So whatever they can do to stay protected, they actually want to be protected.
Okay, so listen to the kids. And then one last thing about the parents. One last bit of advice that you would give them if they are hesitant.
So I would say that as a pediatrician, I want to keep my patients as healthy as possible. And looking at all of the medical evidence that is out there in terms of the data that we have in adults and now in children, I strongly advise getting that vaccine because we want to keep our children safe. We want to prevent them from having any long-term complications from this infection, and we want to bring this pandemic to an end. And I strongly encourage vaccination.
We will see how it goes. Dr. Abraham from Northwestern Medicine, thank you for joining us.
Thank you.